Okay, this is Chapter 5 of the ATI Community Practice Settings and Nursing Roles in the Community. Community health nurses practice in diverse settings. They practice as public health nurses, home health nurses, hospice nurses, occupational health nurses, faith community nurses, school nurses, and forensic nurses. Public health nurses are employed at federal, state, and local levels. The overall purpose of public health is to impact the health of populations through disease prevention, health promotion, and actions that protect population health. Nurses working in public health support the 10 essential public health services: monitoring community health and solving problems, diagnosing and investigating health risks, providing education and empowerment regarding health issues, facilitating community partnerships, developing community health plans and policies, evaluating personal and population-based health services, and researching solutions for health problems. Specific tasks the nurse might be engaged in include the following: intervening to protect the natural environment, identifying problems for populations at risk, collecting vital statistics, managing communicable disease through prevention, scheduling wellness screenings and immunization clinics, fostering emergency preparedness. Home health. Community health nurses provide health care services to clients where they reside. This includes traditional homes, assisted living facilities, and nursing homes. When making a visit to a client's home, the nurse should always take measures to ensure their own safety. The nurse is a guest in the client's home and should respect the values of the client and household members. Community health nursing care in the home setting is great to target specific at-risk individuals and groups. Community health nurses assist client to transition from one level of care to another. Working as a part of the interprofessional team is essential to providing holistic care. Many clients leave the hospital in just a few days and are still very ill. These clients and their family members need skilled services and education about the disease process, prescribed medications, and future implications of their illness. Omaha System Model. Nurses caring for individuals, families, and communities under home health and hospice care often use the Omaha System Model to implement the nursing process. The framework is also used in many electronic health record systems. Steps of the Omaha System: collect and assessing data, stating the problem, identifying an admission problem rating using a problem classification scheme, planning and intervening, re-rating the problems during the span of care, delivery, and discharge, evaluating the end problem outcome. Living environment. The home health nurse must evaluate the living environment for safety, paying close attention to non-secure rugs, electrical outlets, and extension cords, the use of oxygen, low lighting, the need for safety devices in the bathroom, and other potential environmental hazards. Older adults are at particular risk for falls. Questions to ask: does the client have food in the house to eat? Is there help with the household activities? Does the client live alone? Does the client have access to health care? Client education. Home health nurses provide follow-up care after an acute hospital stay. They must educate the client and the family regarding complications or adverse reactions. These instructions can include when to contact the agency, emergency room, or provider. Hospice. Hospice care focuses on enhancing the quality of life through the provision of palliative care, supporting the client and family or friend through the dying process, and providing bereavement support to the family following the client's death. Clients can receive hospice care in a variety of settings, including the home, hospice centers, hospitals, and long-term care settings. Hospice care is a comprehensive care delivery system for clients who are terminally ill. Further medical care aimed towards a cure is stopped. The focus becomes relief of pain and suffering, as well as enhancing quality of life. The hospice nurse provides care for the client and the client's entire family. Hospice care includes skilled direct services and indirect care coordination. Provider directs hospice care services, which are then managed by the nurse. Volunteers are used for non-medical care. Postmortem bereavement services are offered for the family. Helping the family transition from one expectation of recovery to acceptance of death is an important aspect of providing hospice care. Occupational health. All work environments have associated risks. Healthcare in the workplace seeks to both promote health and prevent occupational illness and injury. Through improvement and maintenance of health, workplace expenditures are decreased by less sick time use, fewer workers' compensation claims, and decreased use of group health coverage. Nurses function in numerous roles within the workplace settings and are challenged to provide cost-effective and high-quality care. The occupational health nurse works to promote a healthy work environment to foster the health and the safety of the workers, assessing risks for work-related illness and injury, planning and delivering health and safety services in the workplace. This autonomous specialty entails making independent nursing judgments when providing care to the workforce aggregate. Susceptibility. In assessing risk for work-related illness and injury, the nurse should keep in mind the following factors affecting susceptibility to illness and injury. Host factors. Worker characteristics like job and experience, age, pregnancy, sex, health status, work practices. Agent factors. Biological agents, viruses, bacteria, fungi, bloodborne. Chemical agents, asbestos, smoke, lead, mercury. Environmental agents, musculoskeletal or other strains from repetitive motions, poor workstation worker fit, lift heavy loads, slippery floors. Physical agents, temperature, extremes, vibrations, noise, radiation, lighting, and psychosocial agents, threats to the psychological or social well-being resulting in work-related stress, burnout, violence, interpersonal relationships. Responsibilities. Occupational health nurses' role and responsibilities include the following: primary, secondary, and tertiary prevention. Primary is teaching good nutrition and knowledge of health hazards and providing information on immunizations and use of protective equipment. Secondary is identifying workplace hazards, easy early detection through health surveillance and screening, prompt treatment, counsel and referral and prevention of further limitations. And tertiary is restoration of health through rehabilitation strategies and limited duty programs. Exposure to hazards. An occupational health history provides a framework for a nurse to begin to assess a worker for possible exposure to health hazards. The goal is to identify agents and host factors that place the worker at risk. Information elicited should include the following: current and past jobs, current and past exposure, and any precipitating factors. Site walkthrough. A work site walkthrough or survey is also part of a workplace assessment. The occupational health nurse should focus on the following: observation, job requirements, actual and potential hazards, employee work practices, incidence and prevalence of work-related illness, and control strategies to eliminate exposures. Control strategies are designed to reduce future exposures based upon results from investigations into work-related illness. Control strategies often include engineering, altering work practices, workplace monitoring, health screening, job task analysis. Protection from violence. Work can be frustrating and contribute to stress, resulting in aggression and violence against others. Nurses can refer such workers to employees assistance programs that provide confidential counseling and referrals to other professional services if needed. Protection from work-related injuries related to falls, environmental hazards, and burns. Nurses can use research and trend analysis to improve working conditions by eliminating or minimizing hazards and potential problems. Occupational health and legislation. Occupational Safety and Health Act of 1970. This is OSHA. Development and enforces workplace health regulations to provide the safety of health workers. NIOSH is a part of the Center for Disease Control and Prevention. It focuses on identification of workplace hazards and research for prevention of work-related injury and illness. National Advisory Committee of Occupational Safety and Health. This advisory committee is made up of 12 members representing labor, occupational health, safety professions, and general public. Workers' Compensation Act is a state-level legislation that regulates financial compensation to workers suffering from injuries or illness resulting from the workplace. Faith community. The faith community nurse works with an individual's family and faith communities who share common faith traditions. Most religions have practices that are important to health and healing, and many follow specific practices when caring for an ill or dying member. FICA, Spirituality Assessment Tool, is faith or belief, importance or influence, community, and address, interventions to address. The missionary nurse is missionary nurses seek to promote health and prevent disease by meeting spiritual, physical, and emotional needs of people across the globe. These nurses can be career missionaries or can serve as short-term volunteer or part-time missionaries. Cultural and language barriers often affect the provision of care. Collaboration within the community is essential in meeting goals. Faith community nurse, previously called parish nurses, promote the health and wellness of populations of faith communities. The population often includes church members, individuals, families, and groups in the geographical community. Faith community nurses work closely with the pastoral care staff, professional health care members, and lay volunteers to provide a holistic approach to healing, body, mind, and spirit. School. So the school nursing encompasses many roles: case manager, community outreach, consultant, counselor, direct caregiver, health educator, and researcher. So the case manager coordinates comprehensive services for children who have complex health needs. The community outreach strives to meet the needs of all school-age children by cooperative planning and collaboration between the educational system and other community agencies. Consultant assists students, families, and personnel in information gathering and decision-making about a variety of health needs and resources. Counselor supports students on a wide variety of health needs, and they can provide grief counseling. Direct caregiver provides nursing care to ill or injured children at school. Health educator helps prepare children, families, school personnel, and the community to make well-informed health decisions. And the researcher contributes to the base of knowledge for school health and educational needs. Levels of prevention: primary, secondary, and tertiary. So the primary is assess the knowledge base regarding health issues, teach health promotion practices, assess the immunization status of all children. Secondary prevention: provide care to children who have the following: headache, stomachache, pain, assess all children and staff during emergencies, provide emergency care. Perform screenings, assess children to detect child abuse or neglect, respond to school crisis and disasters. Tertiary prevention is assess children who have disabilities, participate in developing an individual education plan, work with child and family to develop and achieve long-term outcomes, provide nursing care for children who have chronic disorders, including asthma, diabetes, and cystic fibrosis, provide ongoing care for adolescent parents or adolescents who are pregnant. Components of coordinated school health programs. So there's health education, physical education, health services, nutrition services, counseling, promotion of health and safe school environment, health promotion for staff, facilitation of family community involvement, and facilitating safety policies. So health education is inclusion of health concepts and courses of study for children in pre-K through grade 12. Physical education is promoting physical activity in school. Health services is providing health service in school by qualified professionals. Nutrition services is providing access to meals that accommodate the health and nutrition needs of all children. Counseling, psychological, and social services is providing services that improve the mental, emotion, and social health of students, as well as the overall school. Promotion of a healthy and safe school environment reduces illicit drug and tobacco use and violence in schools. Health promotion for staff is promoting activity that encourage health promotion and disease prevention behaviors among the school's faculty and staff. Facilitation of family and community involvement is promoting collaboration between the school, parents, caregivers, and community resources. Facilitating safety policies is assisting with the development of policies and procedures for staff in the event of fire, disaster, or injury. This is particularly important for schools where the nurse is not present full-time. So the examples of levels of prevention, again, primary, secondary, and tertiary. So primary is school nurse places hand hygiene posters near restrooms. The forensic nurse develops a program to prevent infant suffocation. Secondary, school nurse screens for pediculosis. Faith community nurse identifies safety concerns during a home visit. Tertiary, faith community nurses assist in congregate to obtain tube feeding supplies. Home health nurse refers a client with a chronic illness for palliative care. Forensics. Injury is a common cause of altered health that is preventable. Reducing the incidence of injury and promoting recovery reduces the financial burden of the condition. Forensic nurses care for perpetrators of injury as well as victims of sexual assault, substance use-related injuries, human trafficking, physical abuse, gang violence, disaster, and accidental injuries. Levels of prevention. Again, primary, secondary, and tertiary. Primary prevention. Develop and implement injury prevention programs like sudden unexpected infant death and sexual assault. Secondary prevention. Examine victims of crime for indicators of potential injury. Provide direct care to both the client following a sexual assault and perpetrator. Collect and preserve evidence from possible crimes. Tertiary prevention. Provide treatment to incarcerated individuals. Liaison between clients following trauma, medical care facilities, and legal community. Connect clients with community resources after injury.